Welcome everybody. We are going to be doing a live Q&A. Some of you have already sent in your questions, and Som, who is one of the directors of CPH, will be running through those questions with you guys today on a live feed. If you do have any questions still, and if there's anything burning, please feel free to pop it in the Q&A box at the bottom of your screen. As you come in, just say hi and where you're from, and we will do our best to help you with all your questions that you have. And yeah, just keep saying hi and logging in. We're just going to wait 2 more minutes or 3 minutes, and then we will go live. You can also watch this afterwards on our Facebook, College of Practical Homeopathy Facebook page. Just like us there. It'll be streaming live there now. So we're just going to give everybody a few minutes to settle in, and then I will be back in 1 minute. Yeah, just keep popping your questions in the Q&A section. Say hi. Oh, we've got somebody from Czechoslovakia, Ursula from Cork. Tell us how you're all coping with this lock-in at the moment. I will be back in a minute. Just keep logging in and staying tuned. All right, let's see. Sure, we got loads of people. Hi, Mary in North Devon. Michelle in Dorset. Keep saying hi, testing out your little chat function at the bottom. Make sure you say to all so everybody can see. Feel free to pop your questions into the Q&A section, and we will be starting in 1 minute. Already got a few questions. Some, what would you advise for prophylactics? We'll probably be chatting about that. And we'll be talking about remedies. Yes, we will be talking about remedies. All right, hi Debbie. Hi Francesca, sorry, from Hertfordshire. Oh, Maine, that's far away. Annika. Lancashire, Scotland. Tell us how you're all coping with your lock-in. How was your mental health? Have you got children at home? Are they driving you insane? Are you on the front line helping people? Are you looking after the elderly? Let us know how you're coping. Feel free to post it into the chat, and we can potentially do some talking around that. Right, so it is now 3 minutes gone, and I am going to be handing you over to Som, who will be doing some of your Q&As. Hi, Som, can you hear us?
Hi, Tanya. Yes, I can hear you. Can you hear me
cool.
okay?
Yeah, all good. I'm going to hand over to you now.
Thank you very much, Tanya. Good afternoon, good morning, and good evening, and welcome, everybody. We know we've got a pretty good audience. Thank you very much again for tuning in today. And also thank you very much for those who did attend last week's webinar. We've had lots of good positive feedback. Many questions. Tanya's going to help guide me through the questions that you have, because I don't have visibility right now. That allows me to just focus on answering the questions as we can. What I've done is put together some very simple slides on a few questions that have been asked more commonly than the others. So we'll go through them. So this talk shouldn't take too long, because let's focus on answering the questions anyway. So without further ado, let's crack on. Do remember this, everybody. We say this every time in the College of Practical Homeopathy. If there was no healing power inside us, the body wouldn't heal. We must remember that. Whether it's allopathic medicines, drugs, herbs, nutrition, everything helps our body to heal itself. Everything else is just a system to enable that to happen. That's the key thing to remember. Okay, a couple of things we're going to talk about today, and then wait for the other questions. We must remember, do we have coronavirus or is it something else? Again, this has been in the news. The second question, if a family member has it, will I get it? And that's been asked quite a few times amongst my patients and students, but also on the web community as well. And a couple of people who are homeopaths themselves are asking, do we give a constitutional remedy or an acute remedy for acute symptoms? We'll talk a bit about that. We're going to remind ourselves what we can do to boost the immune system. And then I'm going to suggest a remedy or two for prophylaxis. Now, some of these slides are a rehash from last week. If those of you didn't log in, we'll have that webinar available online as well. But that's a good reminder. And then quite a few people have also asked, what happens if I've got a pre-existing chronic respiratory problem? So we'll talk a bit about them. Hopefully that'll answer a few questions, and please keep the questions coming. This slide we put up last week, and it helps us to identify on the left-hand side, is it just a basic cold or an allergy? Do remember, guys, wherever you're in the world, in the UK now, it's spring, things are in bloom, there's pollen in the air. So we're going to go outside and sneeze and itch and what have you. Just let's put it into perspective. Because with the mass media, we're getting a little bit paranoid that the minute we cough, we think, gosh, I've got coronavirus. Now, I've got a cough today, I've got a dry throat. It's because I've been talking so much. It doesn't mean I have coronavirus. So we're forgetting our everyday common sense. On the right-hand side, to differentiate between a flu and a coronavirus, one of the key things is the shortness of breath. They both have a fever, and coronavirus is a flu-type virus. Flu is short for influenza, as we all know. The other thing with coronavirus, and if you're watching the media, it'll tell you it's a persistent cough. For example, I've just coughed there, I'm clearing my throat. But if we're coughing continuously throughout the day, it might be something like that, because the regular flu doesn't give us a persistent cough. So that's something to be aware of as well. So this is a question that's been asked a lot, and especially in the news here in the UK. We've had Prince of Wales, Prince Charles, been diagnosed positively with coronavirus. He's self-isolating at the moment. And his wife, Camilla, she has not been diagnosed with coronavirus as it stands. I haven't logged on for the last 2 hours, so I'm not sure about that at the moment. But that tells us that just because a family member has it, it doesn't mean we're going to have it. Why? One is proximity, the contact and the exposure. How close are we to people? How much contact are we having physically? Are they breathing in our face, etc., and exposure. Second, what are we doing to prevent it? Everybody in the world knows that we wash our hands regularly, and soap and water is the preferred method, not necessarily hand sanitizers, because they also remove the good, healthy bacteria on our skin that prevents infections in the first place. And it also depends, key is this, is the strength of our own immune system. We only really get a virus that overtakes our body when our immune system cannot cope. So we're not victims, we're not scared out there. We deal with viruses, bacteria, and fungus every day of our lives. So the only time we get ill is because our body cannot cope. So the news tells us 80 to 85% of people will actually have the coronavirus and won't even realize they've had it. That reminds us about the healing power within, that our body can deal with it. Then the other question a lot of people ask is, what about a constitutional remedy versus the acute symptoms? Now, for those of you who are homeopaths, as you know, we often treat people constitutionally. Now, that is the person's makeup, who they are as an individual. And if you're not a homeopath, speak to your homeopath and they'll all guide you towards that. And that is used to treat you as a person to maintain good health, what we call the vital force in homeopathy. So when we treat person constitutionally, it's not necessarily always to treat a condition, but it's to treat the person to strengthen their vital force so that they can deal with any illnesses and ailments that may present. A thing that's crucial for that, though, is good diet and nutrition. If I've got a homeopathic treatment to treat me constitutionally, but I'm drinking, smoking, doing drugs, eating junk food, not getting my fruits and veg in, I'm already going to be weak. That's going to be an obstacle for me to be healing, to be in good health. Acute symptoms is what we have in a short-term illness, and coronavirus is an acute illness. It can last anywhere from a couple of days to a couple of weeks. If we get through that and we have pre-existing conditions, which we'll touch on later, that can leave us susceptible or worse off after the virus has gone because we're already weakened. So we'll talk about that later. But the acute symptoms restore our vital force. They promote healing based on the symptoms we have. It helps our body deal with it. And the way we choose that remedy is on symptom similarity. So therefore, if I've got a cough, but I've got associated symptoms, and somebody else will have a cough with different symptoms, the remedy that's suitable for me will be different for a remedy for somebody else. Which is why in homeopathy, we say to people, please don't share your medicine with somebody else, because it may not be for them. It's highly, highly individualized. And I've said it there, we must reiterate that in the UK, if you think you have symptoms, please call 111 or call your surgery and they will direct you to the same. And you can always speak to your homeopath about helping you as we wait for cures and vaccines and what have you. There's so much that homeopathy can do. So if you know your homeopaths, please speak to them. If not, look on findahomeopath.org or go onto our website where you'll see our team who are all qualified homeopaths. How do we boost the immune system? Now, we've revised this a bit from last week for those who didn't get the opportunity to log on last week. Simple things that we've got every day in our kitchens all around the world, and those from other countries will make us aware of other herbs and spices they use: garlic, ginger, cinnamon, honey, lemon, echinacea, holy basil. You really can't go wrong with any of these. And if you want to make your garlic and ginger tea, have a clove of garlic once or twice a day. It will do wonders to boost the immune system. So will honey. Honey is also good. Honey and lemon, as we all know, in warm water, soothes the throat, is an antibacterial, antiviral. Echinacea is a herb that helps to boost the immune system. You can read all about it online. There's a whole host of information out there, as well as holy basil. Now that's used in India quite commonly, and they seem to be doing better than some countries in terms of managing coronavirus. In India, it's called Tulsi, Tulsi. We have our immune boosting vitamins and minerals. We talked about these last week. A, C, D, absolutely essential. Get them in. People who tell you otherwise on the web that vitamins and minerals are no good, it's because they haven't really studied them. And then they'll say things like, the research is lacking or studies have shown. You can't really patent vitamins and minerals. You can just make them and sell them. So therefore, to a big company, it's not worth the investment to spend hundreds of millions of dollars to do a trial. They'd rather do a drug that makes a profit. So that's a reason where the evidence is lacking, but anecdotal evidence over the last 10, 20,000 years with people taking it will speak otherwise. Probiotics are absolutely essential. 80% of our immune system lives and is made in our gut. Then it goes elsewhere and it's stored in the rest of the lymph system. And you can get that in various things like yogurt, kefir, kimchi, even some mature cheeses will have good probiotics in them. The omega-3s, DHA and EPA, they're two of the most important ones. They help to reduce inflammation. So that helps us if we're already trying to battle symptoms and we're unaware. I've had some people ask me, well, Som, I don't feel ill. Do I really need to take this? And I ask them if they're taking stuff and they say, yes. I said, well, that's the reason you don't feel ill. It's preventative medicine, not trying to deal with it afterwards. So it's good daily healthy practice. And if we're limited, we should try and get as much exercise as we can. If we cannot go outdoors, let's do some stuff at home. But then please ensure you get your fruits and vegetables in. That's your natural vitamins and minerals as nature intended. And for those who want to go online and look for herbs, Lematium, I did talk about this before, is known all around the world to boost the immune system and to support the respiratory system. We've had some people ask about chronic conditions, which we'll talk about later. This is something you could consider. And if you have any doubt, talk to your homeopath or your herbalist. And Ceanothus is derived from a herb, and you can give it as a herbal tincture or as a homeopathic remedy. And it's great as an organ support remedy for the spleen. Our spleen is one of the biggest immune system organs in our body, other than the bone marrow. So when we support that, it helps strengthen the lymph system to take our white blood cells where they need to be. And it helps to drain the dead bacteria into the lymph and excrete it back out. Remedies for prophylaxis. Now, we talked about this last week. Prophylaxis meaning what can I take to prevent something happening to me? Well, if we're doing that, we want to stimulate the body, we want to strengthen the body. But then we think about what are we going through to make us worry? We talked about this last week, so it's worth going over again. We have a fear of impending illness and death. We're seeing all around the world that stadiums and exhibition centers are being turned into makeshift hospitals now. So the worry is actually ramping up. And as the cases increase, this is quite imminent to all of us. We still feel helpless because we cannot see an allopathic cure in sight. And yet there's so much we can do for ourselves. That leads to us being anxious about our health, but overly anxious, almost to the state of paranoia, and about disease and death, and fearful for our loved ones. We have a cough, we look at each other when we walk down the street, or we're scared that this might turn into something more sinister. And I'll refer you back to our first slide where we said, is it coronavirus or something else? And we're scared of things like influenza and pneumonia. We're worried that this could lead to something more severe. Pneumonia is an infection in the lungs, could lead to that. We repertorized last week and we came out to a prophylactic remedy called arsenicum. You can see it there as the highest ranking. We also have phosphorus. Now the homeopaths there already know that these are two of the most important lung and respiratory remedies around, along with many others. This is why it's no surprise that the government of India, with their Ayush Health Council, have recommended arsenicum prophylactically themselves. On our website at CPH, we've also issued some guidance on what you can do for COVID. We have a link on that available. And we also talk about arsenicum, gelsemium, and bryonia. But I must stress, ladies and gentlemen, that homeopathy is a very individualized system of medicine. So if you are concerned, please try not to self-medicate just because you've heard some advice. Do seek the guidance of a qualified homeopath. People also ask that, what if I have a pre-existing respiratory problem? How does it affect me? And am I more susceptible? It may affect you and it may make you more susceptible, because if you have a respiratory illness like asthma, bronchitis, COPD, pneumonia, etc., and we're taking things like inhalers, especially steroid inhalers, they are immunosuppressants. They suppress our immune system. Also, if you're taking drugs like methotrexate, that suppresses your immune system. So on one hand, we're trying to boost our immune system so we can prevent any illness getting to us. And on the other hand, we're taking allopathic medications, which may suppress our immune system. Bit of a catch-22. What do we do in that instance? That's why taking supplements, foods, vegetables, fruits, and herbs is so crucial, because while your own system is suppressed due to the medication you may be on, you can do so much to assist your body with external support. So please do not fear in that respect. Gut flora is absolutely key. 90% of all the medications we take out there destroy our gut flora. They land in the gut. Nowadays, we have capsules that say they're designed not to dissolve in the gut and in the alimentary canal. Well, our gut flora actually exists in our colon as well as our stomach, and actually hardly at all in our stomach. So this is very important as well. Probiotics are going to be key, or yogurt, kimchi, sauerkraut, etc. And stay positive. There's so much research out there on the internet to say that when we're stressed, it lowers our immune system. Why? Because our adrenal glands go into overdrive. We're pumping out adrenaline and cortisol into our system. It weakens our body. Our hormones can't do their job, and that makes us susceptible. And before we know it, a cold that should last a day, lasts 4 or 5 days, and it weakens us further. So they were some of the key questions that I've had asked so far. We'll try our best to answer the ones that are coming through. So I'm going to stop talking for a bit, Tanya, and if you can just let us know if anyone's asked us any more. Thank you very much.
Sorry, just having a bit of, I can't unmute you. Sorry, I'd muted you and couldn't unmute myself. All right, so yes, we do have a few questions. We have somebody asking with regards to advice on prophylactics. How could we, or what should we use as a prophylactic? I think you touched on this in the last webinar. We spoke about zinc, wasn't it?
Yep, we've just touched on it again here. Prophylactically, there's so much we can do. We have remedies for prophylaxis. As I've just stressed, please don't try and self-treat. Do seek the guidance of a homeopath. And nowadays, with everyone socially distant, you can phone them, WhatsApp them, text them. You don't have to physically meet them, but just try not to self-medicate. There's a lot of guidance out there. We have it on our website. And yes, Tanya, you're right. There's so much we can do to boost our immune system. So I'm going to keep this up for now. If people want to screenshot the screen, we will have this webinar available for review later. But as it stands at the moment, we'll leave this up.
Also, our clinic is still up and running, isn't it, Som?
Yes.
The students are doing Zoom webinar cases, aren't they?
Yes, we have our next student clinic is on the Saturday, the 4th of April. So for those of you who wish to be treated or speak to a homeopath, we have students currently, undergraduates running the clinic. We also have qualified graduates and we have qualified tutors that are supervising. On the 4th of April, I will be supervising that clinical session. So if you want to be seen, go online, book into our student clinic, and you can have a virtual consultation and see if we can help you as well. Thanks, Tanya.
I'm going to drop in a link to that clinic, which is, the link is on our website, but I am going to drop it in here, and then everybody can click on there if they'd like to have a virtual session with one of our homeopaths. Have you ever used Narayani remedies?
Yes. Now, at the College of Practical Homeopathy, CPH, we have a variety of ways of practicing our homeopathy. We also teach the Narayani remedies, bush flower essences, herbs, nutrition, as well as homeopathic methods, of which the classical method is only one. So we teach about 10 or 15 different methods. And if you study, you'll know that anyway. Do we use them? Yes. But again, on a case-by-case basis, as appropriate. Hopefully that's answered that question.
Great. Would love to know your thoughts about any trials that might be happening globally. For example, any results from India following the government's advice to use arsenicum album as a prophylaxis, vitamin C trials in China, or any others you know of? I know we touched on the arsenicum album thing on the last course, on the last webinar we did.
Yes. Okay. Would you love to know my thoughts on the trials? I don't have any visibility on the trials as yet, but as a College of Practical Homeopathy, we are in touch with many of the international organizations and associations of homeopathic medicine and many councils across the world. So because of that, we will probably get information before it becomes mainstream, but we haven't as yet as I stand and talk to you today. However, the fact that the government are recommending arsenicum album, the fact that China is looking at vitamin C, just underlies the research that's been done with these medicines. Now, vitamin C was discovered by Linnaeus Pauling, 60, 70, 80 years ago, and he made some vast claims for vitamin C. That research is already there, so this is nothing new. Arsenicum album has been proven over the last few hundred years. So we have tried, tested medication here that's worldwide. This isn't something new to the homeopathic community. It's not a new drug that's just come out latest after 4 or 5 months of clinical trials. This has been used globally for a couple of hundred years. So that gives us great faith in the remedies and the system of medicine we employ. So but let's watch this space, but they're not doing anything that we already don't know and learn and teach. Thank you very much.
How do you determine the frequency and potency of prophylactic?
Okay, somebody asked a similar question last week. Yes, we can determine that. Again, it would be case dependent, depending on the person's susceptibility, their state of mind, etc. So, and again, only your qualified homeopaths or students who are into homeopathy will know this. So if you're a general population person who's not qualified, please speak to a homeopath about that. We teach that, but we're not going to do it live. You'll have to either speak to a qualified person or sign up for a course anywhere. Thank you very much.
Somebody's asked if you could put up the repertorization slide again.
Okay, sure. Remember that these were the rubrics that we used in homeopathic speak. So we're trying to turn our words into words that we can look up in the repertory books. And then as we put it into a system or do our scores, these are the remedies that come to mind. So I'll leave that up for a bit. Thanks, Tanya.
Yeah. What is the potency and repetition you would use for homeopathic prophylaxis?
Okay, well,
similar.
Yes, well, I've been asked this by a few people, and if their remedies, if their rubrics fit this, what we're looking, and they come and phone me, and I know the patient, and I've seen them, I will probably give them arsenicum, and I would say to them 30C once a day. That's when me knowing the patient. To the global community online, I wouldn't say that's a panacea for everybody. The government of India have recommended arsenicum to be taken either once a day or 3 times a day. So, and again, that will be administered by a homeopath who will know the person. So the symptom severity, the intensity will decide what we do. Thank you very much.
How much of a factor is inflammation in treating an illness?
Okay, thank you for that question. Huge. We talk about inflammation in the courses, as do many other courses that teach homeopathy anyway. The inflammatory pathways, of which there are many, you have to be a biochemist or an inflammatory specialist to know this, but there's things such as prostaglandins, cyclooxygenase, arachidonic acid. This is what happens inside our cell that causes the inflammatory pathway. Now, inflammation is our body's response to a stressor. We sprain an ankle, the white blood cells go, they swell up the joint, and they immobilize us. So the swelling is an indication it's saying, let me do my job. When we have an inflammation internally, there's something gone wrong in the body, whether it's rheumatoid arthritis or an inflammation of the airways. So we have an allergen or an irritant that's causing that to happen. Sometimes it might be an autoimmune disease that's causing that. So inflammation is absolutely vital. I'm going to move back a few slides because we talked about this. Now we've got the omega-3 acids there, DHA and EPA. One is docosahexaenoic acid, the other one's eicosapentaenoic acid. That's the way they're structured chemically. These are two of the most important omega-3s for reducing inflammation. And if you want to research it online, there are other things out there as well, but these are the two that have had the most extensive studies. They help to regulate the prostaglandins. Now, prostaglandins have a dual function in our body. They're secreted in response to inflammation, and they also help to reduce inflammation, depending on the pathway. So natural omega-3s that are in fish, salmon, etc., some you get through nuts and walnuts and almonds, etc., you can get in your diet, chia seeds, sunflower seeds, etc. This is nature's way of telling us that we need to intake this into our body to handle the inflammation that we face on a day-to-day basis. So very, very important for us to manage inflammation with omega-3s. Thank you very much.
Oh, can you give us some examples of cases you have recently treated or someone with severe breathing difficulties and coronavirus? I understand this is very individualized as always, but would be interested to hear more about this out of interest.
Okay, I've got to be careful how I answer this. Can I give examples? Yes. Will I give them now? No. And I'll tell you why. One, for patient confidentiality. Obviously, I can tell you about cases that I've treated in the last 10 days. There are people who have it. This is UK-based people. They've come with symptoms. We have given them a treatment. Their symptoms haven't gotten worse. They've gone better, and they're on the way to recovery and self-isolating. I was going to say they're out and about, but they're not. So they're sitting at home. So they haven't progressed to being severe. Now that's a combination of being in good health. We had one person who had a very, very bad immune system, an elderly person over 70, what they call vulnerable at-risk person. Now this person had a compromised immune system, did not have a pre-existing respiratory illness, but was a heart patient with a coronary artery bypass graft, diabetic, so highly inflamed, and also had mild arthritis for that age. Not taking any medication for it, but just joints were stiff. So there was a number of treatments we gave. Arsenicum album was one, but we were also treating a few other illnesses as well at the same time. That person had the cough that was persistent for 7 days. And over the last 3 or 4 days, they tell me that they're coughing less, they're able to talk, the wheeziness and inflammation, the phlegm has come out. So we've seen a good few results there. And this is someone who's weak, who's over 70. So that's something I'm willing to share. We will be holding a webinar soon on some case studies, but we just got to go through a few legalities to make sure we keep people data protected. And I think we shall wait a while for this crisis to be over before we get down that. So we'll just have a think about that as members of the faculty and get back to you. Hope that answers that question.
Do you think we need to worry about after the lockdown has finished, will there be an upsurge in cases as people come back into contact?
Hard to predict the future is, so not sure. If we manage this lockdown well and the virus minimizes, I wouldn't see that being a problem, which is why the whole world has locked down pretty much to protect us and prevent that happening. Again, it all goes down to our immune system again. I can be stood in front with 10 people around me coughing at me, but if my immune system's okay, at best I might get mild symptoms. And I'm going to refer us back to Prince Charles. Over the last couple of weeks, obviously he's a very, very busy working royal, meeting thousands of people all around the world, going from country to country. So he's not just protected in a particular environment. However, as we know, he's a patron of the London Homeopathic Hospital, which is now the Integrated Hospital of Integrated Medicine. So has the Queen's been a patron for many, many years. They have a homeopathic doctor online with them all the time, as well as a regular GP. And they always carry their homeopathic remedy kits wherever they travel, which no surprise, they live to be so old, so well, and so healthy. So do I think it will surge up again? I don't know. That's very hard to predict. Can we do what we can? Yes, by being healthy, keeping our vitamins and supplementations inside us, and doing as the government tells us for now. I hope that answers that. Thank you.
Somebody's asking about our home prescriber course and if it could help them in their situation in general, for now and in general. I have put a link up about our home prescriber. It is a very good course. It is not the full homeopathic course, but it's a good taster course. I don't know, Som, if you want to talk a little bit more about that.
Yes, Tanya, thank you very much for that. And whoever inquired, thank you very much for asking. Yes, the home prescriber course, we put this together specifically for people who say, I'm concerned about my health and of that of my family and friends and my loved ones. So it enables us to learn about the system, why we get ill, the different systems of medicine, and also obviously about homeopathy and how we can apply that in our day-to-day lives. So for someone who's keen to learn more, it's a short course. You can do it in a few weeks. You have a webinar and tutorial with us as well to personalize and individualize that training for you. And I would highly suggest you do it. And it's not very expensive. The link and the prices will be online there for you. And what we do find is that once people have done that and they practice for a bit, they often end up inquiring about enrolling as proper professional qualified homeopaths and undertake that journey. It doesn't mean you have to. As a standalone course, it serves many people's needs quite easily. And hopefully, if you have any questions, drop us an email. Thank you very much. Thanks, Tanya.
Okay. I will be putting up a link to the professional training if you guys are interested in the professional homeopathic training, if that's what you'd like to do going forward. But like Som said, the health prescriber is a short course and it's not the full course, but it's quite a good course. Somebody has said, I couldn't find alcohol spray in the shops to sanitize my hands and or to sanitize parcels I've been receiving. Is there a homeopathic remedy I can dilute or put in water to spray onto them as an alternative?
Okay, wow, that's a very, very good question, very interesting question. Now, my mind goes, I probably myself wouldn't use a homeopathic remedy, to be fair. I'd probably be more inclined to use things like lemongrass oil, tea tree oil, just put it in water and spray it on. You can, so essential oils is something I would be looking at for that. Lavender oil comes to mind as well. These are well-known antiviral, antibacterial agents. Australian tea tree oil seems to be a personal favorite of mine. Smells quite clinical though, so you smell like you're in a doctor's surgery, but it does the job. A few drops of that in a pail of warm water, and you can happily wipe or spray your parcels, hands, doorknobs, etc. Many healthcare practitioners and alternative practitioners use tea tree as a cleansing agent in their own clinics anyway. So again, masses of information about that online. That's what I'm using at home at the same time. I do have a bottle of rubbing alcohol as well. I'm using it very sparingly because you can't buy it online for love or money at the moment. Thank you very much. Brilliant question.
So I did something similar. I had some aloe vera gel and I put some tea tree oil into it, and that worked really well, actually.
Brilliant.
Yeah. What doses of vitamins should we be giving children? I think maybe what this person is trying to say is, should we be giving them more, or, you know?
Good question to ask. We can answer that in a couple of ways. The first thing with children is always to encourage them to have a good, healthy diet. That's the number one thing. Nowadays, even cereals, I'm not a big fan of cereals, but they are fortified with vitamins and minerals. Most food is these days. But good old fruits and veg, and in every country you're in, take your native fruits. They're always best because they're made natively. They're not transported. Therefore, they're not preserved or sprayed. Eat as organic as you can. That's probably the first step to take. Second, you can get children vitamins, etc. And if I was going to look online for that, companies I would consider would be things like Cytoplan and BioCare. These are companies that we use particularly as homeopaths anyway, and to many of our colleagues in the community, they'll be well known. As a general rule, if I was just going to go off the top of my head to a person, I wouldn't just give them an individual vitamin. They're designed to work as a group. So a multivitamin mineral works better. The doses in a multi-pack for children should be sufficient. If you're worried, you can double the dose twice a day. If I was looking at the slide that we can all see at the moment, I would use half of these doses. Children do not need as much zinc. Zinc helps to boost the immune system, but children are growing, their immune system responds rapidly unless they're immune compromised and already ill. Therefore, they should be being treated either by a GP or by a homeopath for that alone. So again, it would depend on the individual, their susceptibility, and their lifestyle. Nothing that we're doing is a panacea for everything. It's not a one size or solution fits everybody. So discuss it with your loved ones. But Cytoplan, BioCare, another company is Solgar. These two of the three are the companies that I particularly use. I don't have any affinity or any interest in the companies, full disclosure. I'm not paid by them. I just tend to find that their mix of ingredients and the specific types of vitamins that they put in their ingredients are more bioavailable. For example, now on this list here, we look at magnesium. I've written in there 400 milligrams of elemental magnesium. Now, magnesium is widely known in the world. It's widely taken. It exists in abundance in most of our nuts, especially things like almonds, Brazil nuts, cashew nuts. And it exists as nature intended on a 2-to-1 ratio with calcium. But if we have it in supplement form, there's different types: citrate, carbonate, etc., ionic magnesium. And that affects how quickly and easily the body can absorb it. I'm not going to go too much in depth now. We do teach this on our courses. And I'm actually thinking that we've had a lot of requests are we doing a special nutrition and vitamin course? And we're in the process of writing that currently. So watch this space when we make that available. Hope that answers it. I know I've gone off a bit, but don't just willy-nilly give things to children. Please, please make sure they're eating a full diet first. And then supplement is just that. It's a supplement. It's not a replacement. Thank you very much.
Can the virus live on a soap bar?
Sorry, say again?
Can the virus live on a soap bar?
I'm not sure is my straight, honest answer. So maybe some scientists done some studies on there. I'm not sure. Some people will say that the soap is stearic acid. Soap helps with cells and breaks down cells, which is why we say don't use it on your hands too much because it's very drying, as is alcohol. Do I know? Simple answer is I don't know. So sorry I can't answer that one for you, but I will look. I
think it also depends what kind of soap bar it is.
Brilliant question. Thank you for asking.
There's a lot of questions around can you become reinfected? Are you immune once you've had it? Okay. Do you have any insight into reinfections or into immunity against coronavirus once you've had it?
Okay, very good question. Very specific. So let me go broader before I get specific into coronavirus. Our immune system is designed just to do exactly that. It encounters a foreign substance or something internal that it doesn't recognize and tries to protect us from it by attacking it, digesting it, excreting it, getting rid of it. So that's how the immune system works. And once the immune system discovers it, which is why all these viruses have these proteins around the outside, nature has designed things that harm us, but it's also given us the clues on how we can deal with it as well. Our body has all the tools it needs to handle it. It takes over us. And remember, I'm going to go for the slide, just as well we had a backup slide. Right, I'm just going to go to this. Bear with me, people. Right, just remember this, for those who logged on last week, the virus is on the left-hand side here. And if you can see my cursor, these are all the little proteins that help it to attach onto a cell, but it also helps our white cells to attach onto it and destroy it. So that's what happens. But once it goes into us and our body recognizes it, it builds antibodies against it. So if it encounters it in the future, there's less chance of it overtaking us and the body can deal with it. Does that mean we're 100% immune? We're not 100% immune to anything. Those people who have had chickenpox or shingles, which is the varicella virus, it can reinfect us further down later on in our lives. What that means is that our immune system is not as strong as it was. This is inherently an immune system illness. Viruses are viruses, they always exist. They're just little bits of DNA of genetic code that go in, they hijack our cells, and they make us make more cells. So as it's doing that, it takes over our body. If our body can deal with it, we will be well. If we've had it once, there's less chance of us having it again because our body has the tools and the army to deal with it. We do teach immunology at the course. I know I keep saying this, but that's what homeopathy is. It's a holistic system of medicine where we understand the pathology, how the body breaks down, and then we try and learn how we can support it to make it heal again. So if we go out and about and we're afraid that we're going to get ill, work on your immune system. That's what this is all about. But remember what we talked about here? What we have here, the top line here is fear. If we're fearful of getting an illness, even if we have it, that alone, stress is going to reduce our immune system, and then we will get it. So it's almost self-perpetuating. So be well, stay well, be positive. That keeps all the hormones on the inside that we can't always feel, but making us more susceptible. Hopefully that's answered your question. Thank you.
There's one interesting question here. We've heard that some doctors are trying to administer chloroquine as a potential remedy for patients who have contracted coronavirus. Is there a similar remedy in the homeopathic library?
Okay, now I'll answer that again two ways. First of all, we'll talk about chloroquine. Chloroquine is actually commonly used in the allopathic world, and it was a remedy that the doctors used back at the turn of the century in the Spanish flu around 1918, which killed 50 million people, possibly 100 million. Very, very devastating illness. That was also virus-based. We touched on that last week on our webinar. Now, they used chloroquine and aspirin in those days, and their fatality rate, mortality rate, people who died from it, was 30%. The homeopaths that used remedies in those days, they had a mortality rate of 1%. So is there something similar we can use in the homeopathic community? There can be. We can make remedies. We can even potentize it and make a remedy from chloroquine anyway, right? So that's not a problem. I won't go into the theory and principles of homeopathy today. However, like we just said, when we look at a patient and see their symptoms, we don't necessarily need that as a homeopathic remedy because we have over 6,000 remedies to choose from. And at the time of the Spanish flu, the remedy they used the most then was something called gelsemium. They used it so widely and it was so effective, it became the genus epidemicus of that illness, which means the one remedy that fit nearly the entire population's signs and symptoms combined, that it covered most. It wasn't the only remedy they used bryonia as well, and amongst others, tailored to the patient as the symptoms change. Homeopathy is a system of medicine that looks at the combined symptoms of a person and treats them, and aims to treat them in one go with one remedy. If not, we can add, mix, enhance it. No other system of medicine does that as an approach. So that doesn't mean that gelsemium is the most relevant one now. However, it can be recommended if someone has the aches, the fever, the pains. We haven't listed that on this repertorization here because this one, the question was prophylaxis. It's not about what do I do once I have it. If you have it, talk to 111. If you're in the UK, if you're global, please talk to a homeopath who can guide you, support you, and help treat yourself to do the best you can while your body deals with it. Hopefully that's answered that. Thank you, Tanya.
We have had a few questions on what should I do once I get it. And I think, you know, we just hammer that home, call 111. That's your first line of defense. But I do think maybe some people want to know if there's something that they could use in the interim.
Yes. Okay. Well, our guidance on our website, the Irish government, and the slide that you're looking at in front of you right now says if you're worried about getting it, arsenicum is the remedy you could consider. So we've said this last week, we say it now, it's globally. All the homeopathic associations that you talk to may recommend it. We certainly do at the College of Homeopathy, Practical Homeopathy, along with others. Our guidance will state that this, bryonia and gelsemium have been used. We cannot prescribe for the population on a document and say you must take it or you should take it. It's something that definitely can be considered. But again, do it with the guidance of a homeopath, because right now, if we're worried about getting it, we actually don't have it, so we've got to deal with our fear. Why? Because the fear increases our stress, and that decreases our immune system's ability to handle disease. So we kind of make ourselves worse with it. We have people, we have relatives, we tell them, people are sick with worry. Let's not get to a sick mindset. So please stay positive, people. Thank you very much, Tanya.
And then I think this would be our last question, Som. They say they are trying to create a vaccine. What do you think of that?
Oh, I'll get myself shot for my opinions on that, so I'll keep them to
It's
myself.
quite a controversial topic, isn't it?
Yes, it's very
Vaccines and
controversial.
homeopathy.
You can talk to many people, so please don't take my words on it. I've obviously been a clinical pharmacist myself as well. I come from the allopathic world and I understand how vaccines are made. Would I give a vaccine to myself? No, for my own personal reasons. So you have to explore that yourselves and discover that. You can go online, but again, depending on the source for your information, they're either very good or very bad. If you want a homeopath's opinion, talk to one-to-one. It's not something I'm willing to share because I have a very personal view on them. But if you want to learn more, you can buy books on that. And if you want to send us a link, we can suggest a book on it about vaccines, written about 50 years ago, an American book, very good one actually. And we do talk about vaccines and teach about vaccination, the pros and cons on our courses. And we give many links, government and non-government, to help people inform themselves and make an informed decision. So at the moment, I have no opinion on it, but I'm not the world. Everyone is entitled to their own choices. Thank you very much for that question.
Cool. And I think that's it, unless anybody's got a last quick urgent question they'd like to ask.
Okay.
I don't think anybody does. I think we've exhausted this for now, but I'm sure more questions as the weeks roll on will pop up. If you do have any more questions, please drop us an email. I will put the email in the link below. It's just admin@thecph.co.uk, and we will forward all the questions on to Som. And that was it. Som, any last words of wisdom to the audience?
Just again, ladies and gentlemen around the world, thank you very much for logging on. Please do keep the questions coming, because it also helps us learn at the same time. And questions we don't know, we will research and find out as well. We're a learning institution. We don't have all the answers, but we will endeavor to find them for you. So please keep the questions coming. And if you have any other topics you want webinars on, myself or my colleagues, they're very well equipped to hold webinars. We'd be delighted to offer that as a service. Thank you very much indeed. And please stay safe and stay well, and do not worry. Thank you very much.
Sorry, just one quick question has popped up is, what is the name of the vaccine book mentioned? You don't know it off the top of your head, Som, we can always just email it out.
No, I don't know off the top of my head. I don't know.
Okay, cool. All right. Yeah. Thank you. Okay. All right, folks. Enjoy your evening and stay safe and stay inside.
Thank you very much, everybody.
Thanks. Bye.